I would invite the next presenter, Dr. Meena Chembil, to present on BOTOX, a boon for acute acquired comitant esotropia, the epidemic during the COVID-19 pandemic.
Good morning, everyone. I'll be speaking on botulinum toxin, a boon for acute acquired comitant esotropia epidemic during the COVID-19 pandemic. It's not moving. Okay. As all of us know, acute onset ESO-deviation is an ESO-deviation which occurs suddenly in a previously straight eye, and there is no accommodative component which is usually associated, and no significant refractive error also. So initially, when we used to see an acute esotropia, the first thing that comes to our mind is some intracranial pathology, and definitely they go for a neuroimaging. And it was not that common a condition. But things changed. There was a dramatic change in our COVID pandemic time when the children were confined to their homes and their school were limited to mobile phones and tabs. And there was a dramatic change, and we could see a surge in the number of acute comitant esotropia cases. So our purpose of our study was to assess the clinical characteristics of these patients and mainly to compare the efficacy of botulinum toxin over observation for a period of 6 months follow-up. So it was a hospital-based prospective interventional study, and it was done from 1st June 2020 to 30th June 2021. And the inclusion criteria were acute acquired comitant esotropia of at least 10 prism diopter or more for distance and near with minimal refractive error, no history of prior eye surgery, and no ocular, organic, or other systemic problems. All the patients underwent neurological imaging. We didn't want to miss out on anything, and they were grouped randomly into group A and group B. And group A were treated with injection botulinum toxin type A, 1 international unit for every 4 prism diopter, directly injected slowly at 1 centimeter behind the insertion point of the medial rectus muscle. And group B was kept under observation. So there was a total of 16 patients, 8 patients in each group, and they were age matched, and females were more in group A, and all patients had a sudden onset, and the duration was approximately 50 to 60 days in the groups. So the mean angle of deviation was comparable in both the groups, like it was around 34 to 35, and binocular single vision was present only in 25% in both the groups, and stereopsis also only in 25%. We followed up them for the first month, the third month, and the 6th month, and these are the results at 6 months. And in group A, you can see there was a significant improvement. The success rate was almost 87.5%, and there was no change in group B. They were persisting with the esotropia, and only one patient had a residual in the BOTOX group, and there was no improvement in group B. And there was also significant improvement in binocular single vision and stereopsis, and you can see that it improved to 62.5 in group A and 85% of binocular single vision improvement in group A, whereas there was deterioration in group B. So to conclude, we could say that botulinum toxin is quite effective and safe in AACE, and it can be tried not just before planning surgery. That was what we were thinking about earlier, but it was actually a replacement for the surgery, and we have been following up the patients, and except for the single patient, all the other patients were maintaining their correction. Thank you for your patient hearing.
Thank you. Nice presentation.
Have you seen any other recurrence, or in all cases? Like, it is very good because we have also follow up of some cases, but not all cases did improve at first post-op day. Some had residual, and even for some cases we found recurrence also, because when you follow up these children or adults for a period of long time, they eventually deviate, because if they keep on doing again near work, again medial rectus is contracted, so many times we see recurrence. So for a long time, even for some of our patient, after 8-9 months also it recurred. So it is very important to. And one more thing, the BSV you have checked, it is like whether it was checked for near or distance, if you describe in both terms, it is good.
We have checked in both.
Both
Pardon, madam?
near and distance.
Deviation was checked for distance and
No,
near.
not deviation, BSV, binocular single vision.
Okay,
So
we have
many
checked only for near
yeah,
actually.
so it is
Don't check for
always
near.
checked because so many times we'll
And
see for
what,
BSV
whichever
for near.
patients in this group, no, we have been following up for 1 year, more than 1 year now, and only that single patient had a very actually his deviation was more, and he was the latest. He had more number of days of deviation, and his deviation was also more, and he was the only one whom we had to go for a single muscle surgery because we gave a second injection, but he was not responding.
Whether you have given in any case bilateral Botox to both medial rectors.
Yes.
Yeah. Okay, thank you.
So I had two questions. So the Botox was injected directly or using EMG control? And second, did
madam.
you get any ptosis or any exodeviations in the early preoperative, early period after the injection?
No, we didn't have any exodeviation, and we saw the patients actually after 2 weeks after injection, and there was no exodeviation, only that residual deviation we had, and it was not it was done directly. We didn't have any EMG.
No ptosis was also seen in any of the patients?
Pardon?
Ptosis?
One patient we had ptosis, mild ptosis, but actually it recovered.
Yeah. And the technique of injection was?
It was 1 centimeter. We just got hold of the muscle and gently we kept it for some time.
It is like without any incision, without any conjunctival
No incision.
Thank you.
Thank you.
Thank